This next one is from Victor Manuel Madera Torres. And it says, what's the best way to get rid of sleep apnea? All right, good question. Well, once you have it diagnosed, it's really important that you work with a sleep medicine provider, right? So that you're not trying to deal with this on your own or buying oral appliances off the internet or trying to buy CPAPs off of Craigslist or something like that. You want to work with a professional because, again, we just talked about how untreated sleep apnea is a major cardiovascular risk, and you want that expert advice to take you on that journey. And again, this is where Ognomy, I'm not trying to sell Ognomy, but it's a great platform to address sleep apnea with board certified practitioners to kind of guide you on that journey for sleep apnea. But it's everybody's different, and everybody has different degrees of sleep apnea. So when we diagnose sleep apnea, first you're stratified into certain levels. You can have mild sleep apnea, moderate sleep apnea, or severe sleep apnea. And the way we define that is basically how many times per hour your throat's collapsing down. So if you collapse your throat 5 to 15 times per hour, it's mild sleep apnea. 15 to 30 times an hour, it's moderate sleep apnea, but greater than 30 times per hour, it's severe sleep apnea. Now, you notice I said 5 to 15 was mild. Well, what about under 5? Everyone's allowed to have a little bit of sleep apnea. That's okay. For whatever reason, the throat might, as you relax, you'll have a little bit, but it's not clinically significant. So you're allowed to have a little bit. But once you get more than 5 per hour, you're diagnosed with mild, and then it kind of works its way up from there. So we use different treatments for the different degree of sleep apnea. So really, most of you have heard about CPAP, or continuous positive airway pressure, which is a treatment for sleep apnea, which everyone hears about and everyone says, oh, there's no way I could wear that. It's too big. It'll fit on my face, all these things. When in fact, it's really not. The interfaces are very small. There's little pillows that fit underneath the nose, small ones that go around the nose, and everybody's different. But it's really a great first line therapy for significant sleep apnea, and to whatever degree, because when you're using CPAP, or that continuous positive airway pressure, it sends a whole column of air from your nose into the back of the throat that's collapsing, and just keeps that throat open the whole time. So no matter where you're collapsing, either behind your nose, behind that little punching bag in the back of your throat called the uvula, or the base of your tongue, that CPAP will keep that whole airway open. Other treatments, for example, like the oral appliance for sleep apnea, it brings your lower jaw forward a little bit. And when it does that, it brings your tongue forward, because your tongue is attached to this lower jaw. So by bringing that lower jaw forward, it brings the base of the tongue away from the back of the throat and just makes that throat bigger, and it's less apt to collapse down. This is also a great treatment for certain patients, but you also sometimes want to have some certain characteristic and features. Like, for example, you might want to have an overbite like me. So, that tells me that the base of the tongue is sitting back a little bit. You might have a certain molar occlusion or something that makes you a good candidate for that oral appliance. So that's also an option for sleep apnea. There's also alternatives now. Like, we used to have surgical alternatives that really didn't work. I mean, I told you guys, I've been doing this for 20 years. Believe it or not, when I first started, they were basically cutting out that uvula and soft palate. It was called uvulopalatal-pharyngeoplasty. It was this horrific surgery that was really uncomfortable. And although it worked a little bit initially, they found that the long-term effect of taking that uvula and soft palate out was just not good. And it didn't really treat your sleep apnea, but it caused other problems like snarfing. So if you have a drink of milk or beer, whatever you like to drink, it'll come out your nose. So we don't typically recommend that surgery any longer. But there's a newer surgery called Inspire therapy, which is a hypoglossal nerve stimulator, and that's just a fancy way of saying it stimulates the nerve to your tongue. That's the hypoglossal nerve. That's the nerve that goes to your tongue, and it stimulates it. And instead of bringing the jaw forward to bring the tongue forward, this stimulates the nerve to bring the tongue forward, and it gets implanted. It's a great treatment for patients with moderate to severe apnea that really had a hard time tolerating the CPAP and couldn't wear it. So at least now we have options for that, because before, really the only way to get rid of sleep apnea in a very severe patient that couldn't wear CPAP was actually to do a tracheostomy. So we now have really nice therapies. It wasn't only that, there was something called the mandibular maxillary advancement surgery that you have to break the upper and lower jaw and bring the whole jaw forward. So again, not something we recommended too often, but for patients with severe apnea, again, because of that cardiovascular risk, we really wanted to look to ways to treat it. So the Inspire therapy is a really great addition to our armamentarium to treat sleep apnea in severe patients. So great question, Victor.